Welcome, and thanks so much for joining. Today I'm going to talk to you about stroke awareness. There are important facts to note about stroke. Stroke is among 5 of the leading causes of death in African American women. Actually, it's the 3rd cause of death. Stroke is also the main cause of disability among African American women. But the good news is that the risk factors of stroke can be reduced by as much as 80% if we're willing to make some changes. After this presentation, you'll be able to tell what a stroke is, identify the risk factors of stroke, identify the symptoms of stroke, and know what to do if a stroke occurs. Now let's go further. Stroke can also be looked at as a brain attack. As you know, the brain is our control center. Our ability to think, move, feel, and act are governed by our brains. The brain is the most complex organ in our bodies. A healthy brain helps us to live our daily lives independently, but a stroke can cause injury to our brains that can cause our lives to be disrupted. A stroke happens when the blood flow and oxygen are blocked and cannot provide the necessary nutrients to the brain. Because of this, the cells in the brain die. Once blood flow is blocked from the brain, death or disability can occur. Let's talk about 2 kinds of stroke. A hemorrhagic stroke happens when a blood vessel bursts and there is bleeding in the brain. An ischemic stroke happens when a blood vessel in the brain is blocked. This happens when a blood clot has formed and blocks the blood flow. So we have bleeding in the brain, that is one cause of stroke, or a blood clot that blocks the blood flow as another cause of stroke. Now let's talk a little bit about the symptoms of stroke. The severity of stroke symptoms will depend on the amount of damage done to the brain and the part of the brain that has been affected. Weakness and numbness on one side of the body is a common symptom of stroke. The loss of balance and the ability to move around may also happen if one has had a stroke. Therefore, a person may not be able to move, wash, groom, dress, toilet, or feed him or herself. In addition, this person may not be able to work, cook, shop, or travel. The things that one enjoys most are really likely to be compromised. Also, slurred speech and memory loss may be symptoms of stroke. People may not be able to speak even though they understand what is going on around them, or they may not recognize objects that were once familiar. People may also have problems swallowing and may have to be tube-fed or given soft foods to eat. Other symptoms of stroke may be dizziness that appears unusual. Severe headaches are also a symptom that should not be taken lightly. It's important to pay attention to our bodies because this helps us to know how our bodies typically function. Paying attention helps you to know when something is unusual or when you need to get help. Now let's talk about stroke risk factors. Having stroke risk factors can place a person at a higher risk for having stroke. These risk factors should be understood so that they can be easily recognized and then addressed. It's possible to reduce one's chance of having a stroke by addressing the changeable risk factors. Let's find out more. Stroke risk factors are considered to be either not changeable or changeable. Risk factors that are not changeable are things like race, family history, gender, and age. Risk factors that can be changed and or managed are hypertension, diabetes, atrial fibrillation, cholesterol level, obesity, level of physical activity, eating habits, alcohol abuse, cigarette smoking, and the use of birth control pills. As far as unchangeable risk factors, we are aware that race and family history can't be changed. Statistically, African American women suffer strokes more than women of other ethnic backgrounds. and there are many factors that contribute to this fact. It's also important to be aware of risk factors that are present in our family history. The medical history of our parents, siblings, aunts, uncles, and grandparents is important because it lets us know more about potential health risks that we may also encounter. Other unchangeable risk factors are gender and age. Women are more likely to suffer from stroke and disability. Women typically live longer than men, and the likelihood of stroke increases with age. However, while this is an important factor to note, younger African American women are now experiencing stroke at higher rates. This means that stroke awareness is important for all African American women. But there is some good news. The good news is that again, there are risk factors that are changeable. And if changes are made, the chances of stroke can be greatly reduced. Let's talk about some of these risk factors. The first is hypertension, which is the number one cause of stroke. Hypertension or high blood pressure can be monitored and regulated. The next two risk factors that will be mentioned are diabetes and atrial fibrillation or AFib. People with diabetes have double the risk of having a stroke as opposed to those who do not have diabetes. People with AFib have a 5 times greater possibility of having a stroke. It is important to remain under a doctor's care with any of these risk factors. One would also need to know the recommended care plan and follow it so that the negative effects of these conditions can be greatly reduced. High LDL or bad cholesterol and obesity are other changeable risk factors. We should be aware of our LDL cholesterol level and our weight. High cholesterol can cause heart disease, which can also cause stroke. Obesity puts extra strain on the whole circulatory system and can cause high blood pressure and diabetes. Regular medical examinations can help you to be aware of and manage these important changeable risk factors. Limited physical activity is another changeable risk factor that can cause one to develop chronic diseases if not changed. Also, unhealthy eating habits are changeable risk factors. Evaluating and changing diet to support healthier eating habits is essential to reduce stroke. Alcohol abuse can cause increased blood pressure and is a risk factor that can be changed with the appropriate support. Cigarette smoking is a changeable risk factor, as smokers have double the risk of having strokes compared to non-smokers. Smoking can increase the formation of blood clots because it causes the blood to thicken. Another concern would be birth control pills, which are also considered as changeable. These affect blood pressure. Women, however, should always consult with their physicians regarding any health decisions and health-related questions. We've covered a lot of information today. We've talked about stroke symptoms, stroke risk factors, healthy living. Now let's talk a little bit about what to do if you or someone you see is having stroke symptoms. First and foremost, call 911, especially if you see the face drooping, the arm or leg weak, or slurred speech. Time is critical. because the faster the person can get attention, the sooner the care can be provided. Well, this brings our presentation to a close. I hope that you have benefited from the information in this presentation. Please feel free to share this information with your family members, with your co-workers, with your friends, because we do want people to live healthier lives, and that starts with having information. So we thank you for your time, thank you for your attention, and stay tuned because we have another great presentation coming next week. And this one will be about health beliefs. So stay tuned, see you soon, and have a blessed week.